Good afternoon, everyone. We want to thank you for joining us this Friday, July 10th, for the Flint Community Webinar on Coronavirus. This webinar is sponsored by the Healthy Flint Research Coordinating Center here in Flint, Michigan. And I'm your host today, Yvonne Lewis. And I want to again thank you so much for joining us. It's been our privilege every week for the last 17 weeks to join you in a conversation around what's happening in our community around coronavirus and related issues. The Healthy Flint Research Coordinating Center, for those of you that have joined us for the first time, is an important partnership here in our community. It's multi-institutional. Our partners are, of course, community, along with Michigan State University, University of Michigan Flint, and the University of Michigan Ann Arbor. And we are certainly happy that you have joined us today to learn more about what's happening here in our local community. All of us recognize that this is a global issue, but we want to be sure that we understand how it is impacting us here locally. Today, we're going to feature a couple very important guests as we continue to talk about reopening of our state, which then translates to reopening our county and our city. And we want to make sure that the information we provide to you is relevant and most useful in what we're experiencing on a daily basis. For those of you that are joining us by YouTube, if you have questions and you'd like to learn more today and you want to include your questions or comments, you can go to our website, which is info@hfrcc.org, or you can call 810-835-2130. That's 810-835-2130, and we'll be happy to get your questions answered. For those of you that have joined us during the webinar, we'd like you to know that we have panelists who are available to respond to your calls, and you can go down to the Q&A button and put your questions in. Our panelists are ready and able to respond to your questions, and for those questions that we don't have answers to today, trust us, we will make sure that we get those answers for you as quickly as we can. We want to acknowledge and appreciate those of you who have also assisted us in providing information about the webinar, as well as sharing the information that you learn with other members of our community. We do know that we have more members joining us each week, if not by the webinar itself, but they are viewing the YouTube videos following the presentation that we'll have today. So we want to begin today, as we talked about reopening. One of the big questions that came forward for us in the last few weeks is, as we reopen, how does this impact our community? Particularly, how does this impact our schools? We're certainly happy today to have with us Tricia Hill, who is the Executive Director for Countywide Programs for the Genesee Intermediate School District, and graciously agreed even last week to come on this week to help us to understand what is happening from the intermediate school district level that is important for our families and community to understand. So Tricia, we welcome you now. Please share.
Thank you so much. It's a privilege to be here this afternoon. So what I would like to talk about first is just in general, what schools have been doing to plan and prepare for the return of students. Since March 13th, when we received the initial stay-at-home order, schools began planning. We educated kids remotely through the end of the school year, and then all along the way, really started planning for what's next. Many of our schools in the state and a couple in our county have a balanced calendar, including the GISD. So we knew that we were going to start much before fall. So our planning really had to become quick. But last week, our governor released the Michigan's Return to School Roadmap. And this is what we now know we must use as we begin to plan for the return of students. And in the roadmap, it's quite comprehensive, and I'll talk about how it's broken up as we go through the presentation, and it's all based on her latest executive order, 2020-142, which really talks about the provision of reopening our schools, pre-K through grade 12. So if we could go to the next slide. And you'll see here, the governor really assembled a wide variety of individuals to assist with the creation of the roadmap. She had a return to school advisory council, a task force on education. There were legislators involved in the process, and then also additional contributors. So it was a wide variety of people from all sectors, from business, from education, from the medical community, that went in again to creating this very comprehensive roadmap for school leaders to use as we welcome children back. And again, it's also based on the Michigan Safe Start Plan, which you are probably most familiar with. And this is what the governor uses to really decide on what gets reopened in our state. And also, as you know, we are currently in the yellow phase, phase 4. And so that's the part of the plan that we'll really focus on today. But what are the scenarios for fall? Because as you know, the governor has been very clear that we could bounce backwards or we could bounce forward from those phases in the My Start Safe plan, depending on the data and what our state looks like. So the scenarios for school would be that if we are in phase 6, we're good. There's minimal required safety protocols, and school would be like it has been in the past. All is normal. If we are in phase 5, then schools would be open for in-person instruction with moderate required safety protocols. And all of those protocols are listed very clearly in the roadmap. In phase 4, which we're in right now, for in-person instruction, there are pretty stringent required safety protocols for school, and that's what schools are planning on right now. And if we fall backwards into any of the phases 1 through 3, then we would not be able to meet in person, schools would not reopen, and we would go back to that remote learning, the virtual learning. So in each phase, the roadmap lists topics, and it lists requirements, strong recommendations, and recommendations for each of these topics that you see here on the slide. So under safety protocols, it talks about PPE. So do children wear masks? Do staff wear masks? And each of the phases that's laid out for schools. So schools don't have to guess or make up their own minds. The roadmap really tells them what to do. Talks about hygiene, hand washing, cleaning protocols, spacing and movement of children or social distancing, screening students and staff, testing protocols and responding to positive cases. How do schools do that? Food service and gathering, those common areas, athletics, cleaning, transportation, and those medically vulnerable children. We also have to address the mental and social emotional health of our children in our plans. We know this has been a big issue as children have not been with us for quite some time. And when they do come back, things will be different. We need to pay attention to that and be responsive to children's needs in that area. We also need to plan for instruction in each of those phases, what that's going to look like, and how we support families and teachers throughout each of those phases. And then a very important topic as well, operations. What do we do at our facilities? Do we need to make some modifications? Again, with cleaning protocols, and then our budget, food service, staffing, all of that is impacted. And then of course, technology, if we do go virtual, and transportation. But I think it's important to understand that school districts have really been planning since March. They were planning for worst case and best case scenarios, so all along that gamut there. And we use the guidance that has been made available. And now we have the roadmap and the executive order, and we always fall back on CDC guidelines as well. And a requirement from the roadmap and from the governor's office is that every school district must develop 3 separate plans. If we fall back to phase 1 and 3 for that virtual learning, for phase 4, which we're in right now, and phase 5. We need 3 separate plans that are due by August 15th or before the start of school. And it's important to understand that the plans are unique to each local school district. And at the Genesee Intermediate School District, we are welcoming back students in our center-based programs on Monday, July 13th. And we are having some of our early childhood children for a summer camp starting Monday as well. And the rest of our early childhood children will come back to in-person instruction on August 3rd. So that concludes my presentation, but I'd be happy to answer any questions that you may have.
So Tricia, one of the questions, I know that you work over the intermediate school district. You have connections to most of the schools across Genesee County. Can you tell us a little bit how you're interacting? Because following your presentation, we will be hearing from the Flint Community School specifically. But can you just give us a better understanding of how you're linking to the other school districts across the county?
Absolutely. So even just last Wednesday, as soon as the roadmap was put out, we hosted a webinar for all of our superintendents, and Representative Kennedy joined us. And she was actually on the creation team of the roadmap. And it really gave superintendents an opportunity to ask questions and to share things that they're planning for. We are also just sharing best practices. We meet regularly with all superintendents. Dr. Hagel, the GISD superintendent, calls those meetings. And then Dr. Tunnicliffe stays well in tuned with Lansing, the legislative piece of things, to offer guidance and updates as quick as possible. We also will do things for cost-saving benefits. If we can order supplies or provide services in higher quantity to save money, we also will do that with our local superintendents. But it's a lot of collaboration and coordination with all school districts.
Thank you, Tricia. I have one question from one of our webinar participants. What will happen if parents decide not to send their children back to school, even if we are in phase 5? Just as you know, all people don't follow the rules. So what's the strategy there?
Yeah, and we do realize that parents will make that choice, and it's certainly a personal decision for each family. But there will be virtual options for families that choose not to come back in person. Again, the ISD is working with all local school districts to make those options available. So it would be an online curriculum with support from certified teachers.
Thank you. Now, Tricia, there are 2 more questions. I want to ask you to respond, but also I know Anita Hill, who is the superintendent of Flint Schools, will be able to respond to these as well. But the balance, one question is, Balance School starts July 27th. Do we know anything about that yet?
It would depend on the local district. So each district sets their own calendar. So for example, GISD, our balanced calendar starts Monday, July 13th. So if you have specific questions about your district, I would recommend you contact that superintendent's office.
Wonderful. So we're going to move now to hear from Anita Stewart, who is the superintendent of Flint Schools. And there are 2 other questions in the queue that we will make sure that we respond to as she gives her presentation. I think she may even answer a couple of these questions. So welcome, Anita. We are so happy that you are joining us today, and we want to say congratulations, because for you, you've moved into a very important role here for the students here in the city of Flint. So we look forward to hearing from you. Anita, I think you got to unmute yourself.
Thank you. Thank you for this opportunity. I'm glad to be here with you, and thank you for the congratulatory remark. It is very appreciated. So at Flint Community Schools, we have been working collaboratively with the GISD and working through some of the things that Ms. Hill has identified that schools needed to be thinking about. We started working on our plan back in March. And when we started working on our plan back in March, we were using the Return to School roadmap that was created by Opportunity Labs. In the Return to School roadmap, there are several subcommittees that were identified that school districts should be thinking about. We had a governance subcommittee, a facilities subcommittee, finance subcommittee. We put the instruction and post-secondary subcommittee together. We had a schools operations subcommittee, technology, and wellness. A part of each committee were administrators, teachers, paraprofessionals, other staff within Flint Community Schools, our community partners, board members, union representatives, and parents were also a part of each of the subcommittees. You can go to the next slide. We also sent out surveys to our parents, our students, and our staff. Within the surveys, we had 700 parents who responded, parents or guardians who responded, and their responses stated that they were pretty split on wanting to return to school online, in person, or through blended learning. If we return to school, our parents stated that they desired strong distancing and disinfecting. The majority of the parents agreed that if remote learning was continued, they wanted learning packets to be available as well as the online option. Parents were proud that the district's effort to increase communication through the wellness cause and our technology support. So we had a wellness team that called our parents every week to check in with them to see how it was they were doing, whether or not they had any needs, and if they had any needs that we could support them with, Flint Community Schools did, and if we could not, we referred them to agencies within the community that could help them with the needs that they had. The district's reopening committee, the vision statement, or the vision that we worked around, was providing a safe reopening of Flint Community Schools designed to protect the health and well-being of our school community while maintaining a commitment to excellence in academics, transparent communication, and a whole child approach to education. So that was our vision statement that we worked around with developing our district reopening plan. In our district reopening plan, we have three learning opportunities for our families. One would be face-to-face instruction, that's returning to school face-to-face. The other was the hybrid approach, because we know that the numbers of people who were impacted by the virus started to go down, and now we're starting to see a slow uptick. And so we wanted to be prepared if we started face-to-face and the numbers went up and we had to go back to phase 1 through 3 of the governor's plan, we wanted to be prepared for that shift in having to go back to online learning. And then if so, the numbers started to go down and we can move back to phase 4, 5, or 6, going back to face-to-face instruction. So the district wanted to be prepared to pivot in any direction that we may need to according to the governor's phases. We also are planning for virtual, as some thought that the 2021 school year would be online. And so we wanted to be prepared for if we had to pivot in that direction. Also, we know that if we return to school with face-to-face instruction, we may have some families who are just not comfortable with sending their children back to school, and they would want to continue with the online option. And so we wanted to be prepared for that as well. So with our curriculum team, we developed, or we revised our curriculum pacing chart so that it would be parallel with no matter what direction we had to go. So if we were going face-to-face, the curriculum pacing would still be the same as so our students were participating in virtual learning. And so we looked at our curriculum pacing map so that we can make sure that those were vertical, and students would be receiving the education that they needed to receive no matter which direction we decided to go or no matter which option our parents chose. So we just want people to know that we're enrolling students now. So if you want to be a part of the great things that are happening at Flint Community Schools, our enrollment office is open, and it is open Tuesday through Thursday. Parents can go online and they can enroll their kids, or they can make an appointment with our centralized enrollment office and come in Tuesday through Thursday to enroll your child. And if you come into our office, we have precautionary measures in place where we're taking appointments, and then we also have social distancing that we're practicing with people being inside of the centralized enrollment building. So you can visit our website at flintschools.org to learn more about enrollment. And we are a school that that's on a balanced calendar, as Ms. Hill spoke of, and we start school Wednesday, August 5th. The final draft of our 2021 calendar for our parents who want to know what the calendar looks like. If you have not seen it yet, it is on our website, and you can go to our website and you can see our calendar for the 2021 school year. And as I mentioned, school starts Wednesday, August 5th, and we look forward to welcoming students and staff back to the school and continuing to build on the momentum of the past several years that we have done in Flint Community Schools.
Thank you, Anita.
Mhm.
Great information you shared. Now we have a couple questions for you.
Okay.
You were talking earlier about the wonderful survey that you distributed. 700 families complete the survey. One of the questions was that survey administered in different languages?
So the survey was not administered in different languages, but what we did do was the survey was put on our website. We also had our wellness team that was calling our families, and some of the families that we know that may have some language barriers. So our wellness team reached out to all of our families because we wanted all of our families to participate in the survey. So they reached out to all of our families to ask them if they had an opportunity to complete the survey. If they had not, they helped them to navigate through the survey and to complete the survey while they were speaking with them on the telephone. And so we did offer services for those families who we know have language barriers or just any other type of barrier that some of our families may have had with completing the survey.
Thank you. One additional question. Of course, there are concerns about children with special needs and the distancing. So how are you addressing or what is the plan for children with special needs?
So we do service children who have special needs, and our wonderful LSS director, Melinda Carroll, that team has been thinking through the options of how they can help the students with their needs, because there are different needs. And so they've been working through how they can assist our students who have special needs when they return to school in fall. Some of our students are in self-contained classrooms. And so with those classrooms, we're going to be practicing social distancing with keeping them apart so that we can still educate them as they need to be educated. We have some students who just have social emotional needs. And so our social workers are prepared to work with those families and those students, whether it be face-to-face instruction or whether we're doing remote learning. We had our social workers were contacting our families when we were shut down back in the months of March. They were contacting our families and they were providing some of their social services by phone, by Zoom, and any other avenue that we were able to do so online.
Thank you, Anita. I have a rambunctious grandchild.
Okay.
And so how are you planning to keep these little ones space, addressing it? Recognizing the social distances at 5 and 6 years old.
Okay. So our classrooms are going to be set up so that the desks are 6 feet apart. We also are doing creative things such as the water noodles that the kids play with in the water. They're just like little long foam sticks, right? And so, this is an opportunity to teach our children the different safety measures. Wash your hands often. They'll have the little noodles so that they're walking around the classroom or down the hall. And the little noodles will help to remind them of the 6 feet spacing that they will need to practice when they're moving from place to place. And so we're just thinking of very fun and creative ways that we can utilize to help to teach our young students what it is that they need to do during this time.
So I have one last question, and then this question about special needs, Tricia, I'd like to have you offer you the opportunity to respond to that one as well. But there was a question about specifically Southwestern High School and if there were any special rules or guidelines at that level.
So yes, according to the governor's plan, those students have to wear a mask. And so Flint Community Schools is prepared. If so, our students come to school and they do not have a mask, we're prepared to give them a mask. The sanitizing stations will be in place throughout the school so that our students can sanitize their hands often. We'll be also going over some other rules that our high school students will need to keep in mind. We will also be going over those rules with those students so that we can make sure that all of the precautionary measures are in place and our students are practicing those precautionary measures at Southwestern.
Thank you, Anita. And I want to just appreciate you taking the time today to be with us. And we know this is not the last time we're going to have questions for you. So we'll look forward to you being with us. And I want to remind all of our listeners, and for those of you that want to put questions in the Q&A, you can do that. Our panelists and others will be on for the full webinar to respond to those questions for you. So Tricia, did you want to respond to the special needs question that was raised?
I sure can. And if you don't know, we do educate children from ages 3 to 26 with special needs at the GISD from all over the county. Most of the time they have very unique needs depending on the building they're in. So what our teachers have done and our care teams have done, if they've really looked at individual needs, and we're using every bit of space in our buildings to spread children out. And just making sure we're giving them the best care and providing for those social distancing rules and guidelines, but making sure that children's needs are met. And along with the instruction, we're being very intentional with how we're doing that. So some students might be involved with direct instruction, while others are involved with perhaps their occupational therapist or speech therapy to really transition the activity for kids. Again, just to keep them in mind for that social distancing piece. So it's very individualized and really taking advantage of every ounce of space in our buildings.
Thank you. We want to appreciate both Tricia and Anita for sharing with us today about the community school and the Genesee Intermediate School District. Obviously, we're just getting started. There'll be more to come. So we want you to stay tuned and we'll look forward to hearing more from you. We have also been asked to hear from our community partners weekly. Some of them have updates that they want to share with you, and some are still working through some of those activities to share with you. But we do have our Genesee County Health Department on the line. On the line, you know I'm radio minded here. Our Genesee County Health Department, we want to be sure that we're giving you the up-to-date information. So Suzanne Cooper, who's been with us every week, is also prepared today to share with you what's going on and the updates from the Genesee County Health Department. Suzanne.
Hi, everyone. As of our posting to our website yesterday at 2 p.m., we had 2,285 cases of COVID-19 confirmed via testing and 263 deaths. This is a reminder that that number may not reflect all the cases of COVID-19 that have likely been in our community because of the limited testing criteria that we had at the beginning of the pandemic. As I shared last week, we are concerned because we're seeing a steady increase in the number of cases, and this week we've seen an 18% increase in the number of cases, particularly in the age range of 20 to 29 years. So it is truly important that we remind everyone to mask up, to use hand sanitizers or wash your hands frequently, again, maintain social distancing, and do all of those preventive practices that we've talked about. We've also shared how important testing is, and so we've mentioned a number of testing locations, and the Rite Aid locations in Swartz Creek and Flint are still available. The registration process is through their website. Hamilton Community Health Network continues to do testing at their North Point Clinic and at the Burton Fire Station, which is at the corner of South Saginaw and Bristol Road. Michigan Health Specialist is also doing testing at their locations in Flint and Burton by appointment, and the Walmart Supercenter is doing testing Monday, Wednesday, and Friday, again, via the Quest Labs website. We do have testing happening today at Shiloh Missionary Baptist Church. That will be ending at 1 o'clock. We also know that we will be at Word of Life next Friday and Saturday from 9 a.m. to 1 p.m. And the following Saturday and Sunday, the 24th and 25th, will be at Beecher High School between 9 and 1, doing testing in conjunction with the National Guard and other partners. So we want to make sure that you're aware of those, and we are continuing to work on other locations in the community, and we'll share more of that information as it comes. But again, recognize that we are seeing an increase in the number of cases, and an increase particularly in this age group of 20 to 29. So it's really important that we all practice prevention, not only to protect ourselves, but for those that we love as well.
Susan, can I just ask you a couple of quick questions here before we hear our next panelist? When you mentioned the number, you said over 2,000 as of yesterday, and I didn't get that exact number. Was that just for one day because we're doing so many additional testings? Or
no, this is from the entire time frame from the beginning of the pandemic. We have had 2,285 positive COVID-19 test results with 263 deaths. We mentioned last week that we had started more testing with loosened criteria for that testing about the second week of May. And that has allowed us from that second week of May, when we had about 4,000 tests completed in Genesee County, to now to complete over 17,000 tests in Genesee County. So testing is more widely available. Clearly, we're making strides in getting people tested, but there are still challenges. And so we know that there are folks that can't navigate through a website, might not have a computer at home. So we are working diligently trying to get more locations in the community where you just show up. You don't need a doctor's note. You don't need anything except the information that is required for registration, and you can get your test on site just by waiting in line. So that's what's happening at Shiloh. That's what will be happening at Word of Life and at Beecher High School, and that is what we hope to see happen in the community locations that will be coming in the future.
So I'm just going to ask one more time, Suzanne. Now we know Shiloh will be done by 1 o'clock today, but if someone know it's a family member that needs to get tested, and they can call them right quick, maybe they can get in. If not, next week, you're saying next Thursday and Friday, or is it Friday and Saturday? Give us those dates for next week.
Friday and Saturday next week and the following week. Next week will be Word of Life, the 17th and 18th. The 24th and 25th, that's a Friday and a Saturday at Beecher High School. And again, recognize that those other locations are available for testing. And if someone has an urgent need, again, there are other doctor's offices, urgent cares, and other facilities in our community that do offer testing, but these are specifically set up to address the needs of our community.
So while we're here, it's really important, as Dr. Reynolds always says, it's not a one and done. So if you're out and about, please utilize these resources that we have to get the testing done. And there's no appointments with the weekend testings that are happening. And I do have one question for you, Suzanne, because you mentioned, and this is from one of our audience, our participants today, you mentioned that there was an 18% increase, and it is primarily in the younger population. The question is, how can we be considering sending students back to college campuses if this is the case? And I know we also have a couple of other physicians on that might want to chime in on this question as well.
So the increase is not just in that 20 to 29-year-old age group. It is more widespread across the board, but it is concerning to us that we've seen an increase in that 20 to 29-year-old age group. Recognize that we've had 2 holidays, we've had protests, and we've had other activities that have happened in the last few weeks that could be, again, contributing to some of these numbers. But the recognition is, as the economy opens up, it's even more important that all of us practice those preventive measures.
Thank you. And we'll talk about some preventive measures in a little bit, but I want to ask Dr. Tupper if he would unmic. And we're always excited when he can come on because you can see he's in his work garb and he may have to jump off and go get busy in the hospital. But Dr. Tupper, this is a critical question for us as we see an increase in cases, but also, we've talked about the fact that the hospitals are working to be as safe as they can, and there are people who need to present even though they don't have COVID. So can you give us an update?
Yeah, so right now, as far as hospitalizations go, we've been at a steady low number of hospitalized COVID patients over the last several weeks. And so continue to have a low number of patients requiring hospitalization. It's been at our institution 2 or 3 patients for the last several weeks. So in the hospital of patients requiring hospitalization, it continues to be low. That being said, I echo Suzanne's observations that we are seeing an increased number of cases, particularly tested at our facility in ambulatory settings like doctor's office and urgent cares, of patients that are testing positive. And certainly we are doing more tests than we were before. So we are hopefully capturing more cases, but we're also seeing not only an increase in the total absolute number of positive tests, but also an increase in the percentage of patients that test positive, which is very important to follow because that reflects not only increased testing, but increased disease prevalence. So I do want to continue to encourage caution. Our observation as well is that it is predominantly younger people in the 20 to 30 age range that are positive cases that are otherwise healthy and not requiring hospitalization at this point. But hospitalization can often lag beyond a positive test result for several weeks. And we certainly don't want these young people that are testing positive to go home and infect other at-risk family members. So once again, encouraging social distancing, wearing a mask, hand hygiene, and keeping your distance, again, is tremendously important.
Thank you, Dr. Tupper. I don't think we can share those messages enough, but we also, if you could expand upon the conversation we've had before about the importance of people who are having other health conditions beyond COVID and the importance of them seeking the appropriate medical care. Yeah,
that's absolutely true. One of the unintended tragedies of in addition to the COVID-19 pandemic is not only those that were afflicted severely by COVID-19, but also those that delayed or did not seek care for other medical conditions and had bad outcomes or worsened outcomes due to not seeking care. So in the healthcare setting, as we've talked about previously, we're making every effort to decrease the risk of any transmission occurring. And the big thing is in the healthcare facilities, masks are mandatory, as they are and as they are per Governor Whitmer's order today in all indoor facilities. But really emphasizing the mask wearing, the cleaning procedures, the hand washing, the cohorting of patients, that we will keep you safe when you come to the hospital for both COVID-19 and other medical conditions. If you have concerning symptoms, if you have chest pains, if you have shortness of breath, if you have stroke symptoms, if you have other emergent conditions, don't delay in seeking medical care because we don't want you to have worsened outcomes out of fear or preservation. We have plenty of hospital capacity and resources right now. We're concerned about the uptrend, but we'll continue to monitor. And so don't delay seeking medical care if you feel that you need it.
Thank you, Dr. Tupper. And we heard some also hopeful news that sometimes people feel like the hospitals will be overwhelmed and they may not take patients who need care. But it was confirmed for us this morning that Hurley will not turn any patient away that needs care. So we
Absolutely.
appreciate knowing that. All right. So one of the things that Dr. Tupper, you mentioned that I think was really important, this is going to get us back to talking with Kim Van Slyke from the health department. As we're seeing this increase of positive cases, there also needs to be some contact tracing with all these activities that are going on, because we want to reduce the spread. We want to also be able to follow up with people who are testing positive and may have been exposed to someone else. So Kim, can you bring us a little insight on what's happening currently with the activities around contact tracing?
I heard my name at the beginning of that, Yvonne, and then your volume cut out. So what am I supposed to be reporting on?
I'm sorry, you said my voice cut out. I'm so sorry. The contact tracing, how are there any updates that you'd like to provide for us? Because we want to be sure that people understand the importance of contact tracing.
Yes. Again, the message is please answer your phone. If you have a strange number calling, if you see a caller ID that says my COVID help, or if you see a caller ID from an 866 number that indicates you are getting a call from the state and they are trying to do contact tracing with you, which means you have been identified as a contact to someone who has tested positive, and they have given us your information so that we can contact you and find out how you're feeling and tell you what you need to do to watch your symptoms and monitor your health for the next 14 days. So just keep answering the phone so that we can help you help yourself. As far as other updates, we are still in the process, getting closer every day. We had a meeting this week on how our transition from the state contact tracing to the local Genesee County Community Partner Volunteer Program, and that we're hoping will be up right around the end of the month, beginning of August is our goal currently. Anything else that I need to add in there? I know.
I think that's good. And we get some additional questions that come up, I'll call you. I'll call you out.
Thank you.
Thank you. And as we move forward, we know that our state is doing wonderful work to help us to understand what's going on. Our county and our city is also making strides in helping us know how we should respond during this time. So Dr. Reynolds is on the webinar with us today. I like this picture because he's going to give us some more good information, because it's not a one and done. Dr. Reynolds.
Yes, and when I say it's not a one and done, if you've been tested a month ago, you are in a situation where you're moving about more, or a work situation, you may be need to be tested again. And that's why I say it's not a one and done situation. So as we open up, the instructions on the frequency of retesting, I hope, will become more clear, and the sites for retesting will become more available. I have heard while I was attending another meeting that our governor has required people to wear masks in any public setting. And it is a felony should you choose not to wear a mask, a misdemeanor rather, if you choose not to wear a mask. I'm not a lawyer. However, nobody needs the hassle. And remember, wearing a mask is not just for your protection. It's for the protection of the people immediately around you, but it's also for the protection of people when you go home. And as I've said before, it's also for the protection of people you don't like, but the people you don't like may like some people you like. So you always have to think about others as we step out during this time. Our governor, following the lead of our governor, the discontinuation of water shutoffs has been extended. And as many of you know, there have been no water shutoffs during Mayor Neely's administration, and there have been water reconnections and we are still looking for people who need their water reconnected. And the number is 810-410-2020. But also, this has been extended to the 31st of December 2020 in the entire state. Now, I caution you, this does not mean you will never have to pay a water bill again, but it does mean that you have that protection, and hopefully COVID-19 won't be as big a problem then, hopefully, but I'm sure the governor will respond to that when it's appropriate. We are also continuing with the management of the lead water crisis, the Flint lead water crisis. There are still service lines that need to be replaced. And thankfully, due to a settlement with the city and the Natural Resource Defense Organization, Blue Conduit has offered a website that gives us as accurate as we have available now, as accurate as now, an idea of what houses that have known copper pipes, that have low likelihood of lead pipes, and that have high likelihood or known lead lead service lines. And you can identify your own address. You just put in your address, your complete address, and you can identify these households. Now, the resumption of lead service line replacement has continued. But if you have a question, we do need you to call 810-410-2020, and there are public health navigators as part of the city of Flint who can direct you through the process. And I repeat myself, don't say no to yourself. Get the information so that you can make an informed decision. And lastly, school is starting. It's time to get your immunizations updated, whether school starts in 4 weeks or 3 months. You must have your immunizations up to date. All those conditions that we talked about did not go away just because COVID-19 is around. And this advice about immunization also goes for us old folks and adults. You need to make sure your immunizations are up to date, and get ready to get your flu vaccine when it's available at the end of August. You can get it from your physician, you can get it from the health department, you can get it from your drugstore chain. But prepare now. Make a plan now. Thank you.
Thank you, Dr. Reynolds. You touched on a whole lot of information there. And I just want to recap, when we talk about this company, Blue Conduit, they have agreed to come and participate in the webinar next week so that they can give us real detailed information on the map, how it was developed, and how we can best use it. So we want to encourage you, please join us next week on the webinar. We will give a specific attention, because what we do know that the water crisis is not over yet. We're still dealing with many issues, and some of our concerns are just layered on top of with water and COVID and other health conditions as well. So we do want you to join us next week as we have the representatives from this organization to talk to us more. I also want you to know there is some work being done to provide community supports for the vaccinations as well, and you will be hearing more about that. Our governor, as always, has sent a representative, Gary Jones, who is ready to give us good information about what is happening at the state level, and we appreciate Gary. I don't know if you all have really got on his list yet, but if you're on his list, you're going to hear from Gary a couple times a day, at least, about what's going on at the state relevant to Flint in Genesee County. So specifically for Flint, Gary, would you please share with us today?
Yeah, thanks, Yvonne. I definitely put on a little bit more weight since this photo was taken, but it's good to be reminded of this guy. Just going to do some brief report outs. Actually, Dr. Reynolds covered a little bit of this stuff, so I'm not going to belabor those points. But total confirmed cases for COVID-19 statewide, we're now at 67,683. Total COVID-19 related deaths are at 6,024. And total of recovered COVID-19 cases as of July 3rd are 52,841. Just as a note, recovered is defined as the number of persons with a confirmed COVID-19 diagnosis who are alive 30 days post-onset. So recently, and very recently, as of today, this morning, the governor took swift action to save lives and signed an executive order requiring mask use in all indoor public spaces. So this was via an executive order, and it's actually following the recent uptick that we're seeing statewide in COVID-19 cases. And this is to reiterate that individuals are required to wear a face covering whenever they are in an indoor public space. It also requires the use of face coverings in crowded outdoor spaces. And most significantly, the order requires any business that is open to the public to refuse entry or service to people who refuse to wear a face covering with limited exceptions. And this follows actually orders that are similar in other states in the country, such as Kansas, Maine, Nevada, Pennsylvania, and Washington. The governor also really signed outlining workplace safety guidelines for meat and poultry processing facilities. This pertains to workplace safety guidelines for meatpacking plants to keep employees safe. We know that meatpacking plants have employees that typically work in very close quarters and have been proven to be a hotspot for COVID-19 infections in other states. So this is why it's important for these facilities to space employees out and ensure they have the proper PPE to keep themselves and their families safe. The governor also recently signed an executive order, this is an executive directive to improve equity across Michigan's healthcare system. So these are new rules that will require healthcare professionals to undergo training to help reduce racial and other disparities in delivery of medical services. So via this executive directive, it directs the Department of Licensing and Regulatory Affairs, or LARA, to begin developing rules that will require implicit bias training as part of the knowledge and skills necessary for licensure, registration, and renewal of licensing and registrations of health professionals in Michigan. Implicit bias training was one of the recommendations made by the Michigan Coronavirus Task Force on Racial Disparities, which the governor created in response to the devastating and disproportionate impact the pandemic has had on people of color. The governor also recently extended the water reconnection executive order, and Dr. Reynolds did such an excellent job covering this. I won't belabor. A thing that I will add is that this order outlines priority for Michigan to also move towards water affordability and to call on the federal government to provide additional water assistance. And lastly, the governor signed an executive order closing indoor bar service throughout much of Lower Michigan to protect the progress that we have been making against COVID-19. So again, this is indoor service at bars throughout most of Lower Michigan to the progress that we made against the virus. We know we have seen upticks all throughout the state, and we don't want to continue to move in that direction. And as always, just as a reminder, michigan.gov/coronavirus is still the best website to get updated. But if you send me an email, like Ms. Lewis can, I will make sure that I add you to my updates list too.
Thank you, Gary. Just one other quick thing about the evictions. I understand that there's been an extension through July 15th on that. And so we want to make sure that people understand that there are some opportunities for them to maintain their homes. I have a question. While we're talking about the wearing of masks, back to our schools, there was a question about the teachers. How will the teachers ensure that the children wear masks? And what about the teachers who are with underlying health conditions? How will that be addressed? And this would go to Anita and to Tricia.
So yes, the staff will be wearing masks. For the little children, we are planning on hopefully having our staff to wear the clear mask, because we know that our pre-K students, our kindergarten students, they need to see the body language of our staff. And so we are planning for our staff of our younger children to wear clear masks so that they can see the body language of the adults. What was the other question? Oh, the staff who may have underlying health conditions.
Health conditions,
So
yes.
at this point in time, our Human Resources Director, Cassandra Washington, she's working with our bargaining units, because we know that we may have staff who have underlying conditions, who may be at high risk, right? And so we want to be able to have some staff who can return and do face-to-face instruction, and we also want to have staff who can do the instruction online for our students who elect to do the online option. And so Cassandra Washington is working with our bargaining units through those situations, because we do want to be conscious of our staff who have those underlying conditions.
Thank you, Anita. Did you have?
Could I?
Yes.
Yes, I'd
Sure,
love to add
Tricia.
something. And I think that's why it's really important to take a comprehensive approach. The mask is certainly one piece of health safety, but it's also about social distancing, overall hygiene. So routines where we're all, adults and children, washing hands regularly, hand sanitizer, our increased cleaning protocols in the classroom, in the high traffic areas, and just throughout the building. And then also just promoting screening with children. And I know at the GISD programs, we will be taking the temperatures of children before they either get on a bus or come into the school.
Thank you, both Tricia and Anita. These are just really important questions, and I'm sure as we move forward, we're going to ask you to stay with us, because there'll be more. For those of you that have questions, our team is answering the questions in the queue, but we're also trying to answer them openly, so those who do not have access to that can hear the responses to these questions. You may feel like this is redundant, but we're going to ask our resident doctor, Dr. Susan Wolford, to talk to us about following the protocols and making sure that we're all staying safe. Dr. Wolford. Dr. Wolford, are you there?
Sorry, just trying to unmute myself there.
Okay.
Hi, Yvonne. Thank you so much for this opportunity to share a few words of a call to action. I know we have heard already that about hand washing and social distancing and mask wearing, all of which cannot be overstated, the importance of it. But I want to add something else today. And over the next few weeks, I'm going to emphasize one of these ideas a week that we can do to keep our immune system in tip-top condition, so that if by chance we come in contact with the virus, and if by chance it makes it through our mask, we are ready to fight it off. And so today, I would just like to mention nutrition. Trying to improve our nutrition so that it is as healthy as it can be. And one particular part of our nutrition is our intake of sugar. So can you see my little artwork here, my number 9 that I've put up in, I thought we were talking about school, so I did a school-like artwork on the background there, number 9. I want you to remember number 9. If you go through your cupboards and you find foods that have 9 grams or more per serving of sugar, don't buy them again. I know you thought I was going to say throw them out. You don't have to throw them away, just don't buy them again, because we want to have an intake that is low in added sugar, but high in fiber and vitamins and minerals. So that's our call to action today. We want you to decrease your intake of high sugary foods, and you can do that. One way is to remove items that have more than 9 grams of sugar in them.
Thank you, Dr. Wolford. Thank you so much. Dr. Deborah, you have always also had something wonderful to share with us as we are getting the last questions in the Q&A. I want to give you this opportunity to give us that epidemiological perspective. What's the data say?
Well, we're at the end now, so I don't think we quite have time for that, so I'm just going to roll through it. Some quick recommendations for folks. There's still a lot that you can do within your hands. Stay safe, honor the protocols. Complete your census. The allocation of resources for us are going to be more important than ever in post-COVID recovery. And please make sure you vote. Make sure you vote. That is the tool that we have to send the signal out to these elected officials. We appreciate the work you've done, or the work that you did and how you served me didn't work. So your vote is your voice in this matter. Thank you, Yvonne.
Thank you, Dr. Deborah. We want to thank all of you. Remind you that there are support groups, efforts available to support you. Please look at this information, and if you need the support, find your way to get some assistance. We want you to join us next week as well. Remember the survey that we'll be providing for you immediately following this. Subscribe to our YouTube channel, become a partner with us so we can continue to do this work, because you've asked us to share with you through the information you give us on the webinar survey. It will help us to help get the information that you're requesting. Join us next week, July 17th, for more information for our Flint community. Put a local context on what's happening around the world. So again, thank you for joining us, and we will see you next week.